And Johanna Contreras, I'm the associate professor of Mount Sinai Hospital, and I direct the network for heart failure care at Mount Sinai Health System. Yeah, it happened really lately in the past 2 decades, an increase in mortality in maternal health, both in the female population, in the mom, and also in the babies. Because we know that women that have difficulty during pregnancy will have complications with the pregnancy. We have been a significant increase, especially in cardiovascular disease during pregnancy. It's named hypertension, increased diabetes, obesity, and all these complications can cause complications during pregnancy and obviously for the baby. So the fourth trimester is very important, and we are advocating for this with the American Heart Association. Basically, we know that women during pregnancy will probably have some access to care, but sometimes they forget that if they have complication or cardiovascular disease before the pregnancy or during the pregnancy, it's very important that those complications or these diseases can be taken care right after pregnancy. Sometimes when the mom had the baby, she forgets herself or really she's focused on the baby, but it's very important that any patient that have cardiovascular disease during pregnancy has a very close follow-up with their doctors, because the blood pressure will have to be controlled, the diabetes needs to be controlled, the obesity needs to be controlled, and some female patients, some women will develop postpartum cardiomyopathy, and that can happen even after the delivery. So postpartum cardiomyopathy can be occurring after delivery, and that's the development of heart failure, and that needs to be treated as soon as possible to have the best possible outcome. Yeah, unfortunately, what we have found is that women of color, African Americans, and Hispanic patients tend to have higher mortality and higher complications during pregnancy. We also know that, unfortunately, our population tend to have more hypertension, more diabetes, more obesity, and probably less access to care, probably less quality of care. Probably they don't have lower socioeconomic status that also make it difficult for the patient to have the right food, the right education, the right exercise routine. So it's very important that especially we focus on these women and we actually take care of them the best possible way. And if somebody has problems before the pregnancy, it's important that they get treated before the patient gets pregnant. Yes. So if the patient develop high blood pressure, the hypertension, there are many kinds of hypertension, but there are some kinds of high blood pressure that can develop eclampsia and preeclampsia. So when that develop preeclampsia all the way to eclampsia, that could be with convulsion, with seizures, with proteinuria, with renal failure, it's very important that these patients be treated immediately in the hospital. And sometimes these complications may happen, and the patient may have to have the delivery of the baby sooner rather than later to protect the health of the patient and the baby. So it's very important that these complications be treated quickly. Diabetes can get out of control and produce significant problems in the baby and obviously in the mother. Obesity is very important because we know that patients that are obese during pregnancy or they gain too much weight during pregnancy will tend to have diabetes and obviously all the complications of the diabetes. So it's very important that these complications be treated acutely during pregnancy. And post-pregnancy, if the patient is in significant treatment, they have to have a discussion with the cardiologist or their OBGYN so they can actually determine which medications you can take. Sometimes due to the treatment, the patient won't be able to lactate because obviously some medication will come into the breast milk and will have effects on the baby. So it's very important that all these factors get discussed with the patient to have the best possible outcome in both baby and mom. It is very important that any woman that wants to get pregnant get a prenatal visit, and we really are advocating for coverage at the government level because every person, independent of your age, sometimes women think that because they are younger, they don't have any problems. That's not true. Unfortunately, we have seen a significant uptake and increase in hypertension, in high blood pressure, in diabetes, and in obesity, even in younger patients. If these factors can be considered before the pregnancy and can be treated and controlled before the pregnancy, you will have a more better outcome for the pregnancy. So it's very important that any woman that be considered to get pregnant have a prenatal visit. The same thing goes for older women. A lot of women, professional women, have delayed pregnancy because of their school and education. So it's very important that these patients, before they consider pregnancy, we have a complete visit so they can have all these issues taken care of and maybe modify some of the risk factors, like maybe lose the weight, control the diabetes, and modify the blood pressure. So when she gets pregnant, she has the best possible outcome for her and the baby, and overall the best possible outcome after pregnancy. I think it's very important that we take care of our moms and our babies. Our moms and babies are going to be the future of our country. In the best possible way, we can take care of them because our moms and babies and our pregnant moms are the best that we have. The future of our country depends on this. If we don't provide the best possible healthcare to this population, obviously we're going to have consequences later on. If a baby is being born with complications of a pregnancy, of a bad pregnancy, obviously he's going to have complications later in life. So it's very important that we focus in this. And obviously, if we are allowing women to die during pregnancy, we really are not providing the best possible care for our population. So I think it's very important that we focus on this. It's very important that we consider all the risk factors, and it's very important that we consider to have a prenatal visit to be able to control the risk factors so we have the best possible outcome later in life. Oh, that was good.